Hello, I'm Elliot Benjamin. I'm an ENT consultant with a particular interest in paediatric or children's ENT surgery. One of the common sort of cases that present to our clinic is children who seem to have reduced hearing. They may present because the parents have noticed they're having the television turned up loud or they're missing certain commands, whether at home or at school. But they may also present with speech and language problems where they've developed a good vocabulary, but their pronunciation may be slightly poor. Other children may come to us because they've noticed at school some reduced concentration, they're living in their own world, not reacting with other children. Or also some children may have an increased sensitivity to sounds. They go to birthday parties and they're covering their ears because of the noise and they don't like these noises. Similar children may also have nasal symptoms such as having a very blocked nose on a regular basis or snoring or mouth breathing. And all these symptoms may indicate a possible diagnosis of glue ear. Glue ear is where some benign fluid, like mucus, builds up behind the eardrum, becomes thicker and thicker, blocking the hearing and reducing the hearing, increasing sensitivity or irritability to sound, and affecting the quality of the hearing. So often they hear words as if they're underwater, and therefore it will affect the way they learn words and their subsequent vocabulary. So when we see the children in the clinic, obviously we're going to examine their ears. We have a look at their eardrums, and the eardrums may appear dull with the otoscope. So normally when we shine a light in the ear's full of air and it reflects the light and we see a nice shiny eardrum. When there's glue ear, the eardrum will look dull, suggesting there's fluid behind the eardrum. We'd examine their nose and their throat, and they may have large tonsils as well associated with it. Obviously, we'd go on to perform a proper hearing test. In older children, this will be a normal hearing test where they listen to sounds through a headphone and they'll either move a toy or press a button in response to hearing the sound. For younger children, they can't tolerate doing this, and therefore they'll have what's called a visual response audiogram, where they'll sit in a soundproof room, sit on their mother's lap, and when they hear a noise, they'll look up at a toy or a picture that lights up, and that's a reward for hearing the sound. And that way we'll get a relatively accurate picture of how their hearing is. We'd also perform what's called a tympanogram, and this is where we look at the movement of the eardrum in response to a sound. What we should see is a graph showing a movement of the eardrum bounces away and bounces back again, like a small hill. However, when there's glue ear, you get no movement or very little movement in a flat line. So as the sound hits the eardrum doesn't want to move because the ear is literally underwater, under fluid. Glue ear happens really for two main reasons. Partly because of the anatomy of the ear, the eustachian tube, which goes from the nose to the ear, and that's there to try and ventilate the ear. In young children, it just simply doesn't work as well as it should. The other reason is also in young children, they have large adenoids, which sit right at the very back of the nose, where the nose joins the throat, and that will also cause some of these nasal symptoms we discussed, such as nasal blockage, snoring, and mouth breathing, but also affecting the glue ear as well. So how do we treat glue ear? Well, it's very important to understand that many children will get better spontaneously. If you leave children, about 50% after 12 weeks will go back to normal hearing. If you leave them another 12 weeks, another 50% will get better spontaneously. Now, obviously, sometimes this doesn't happen and we have to go to the next level of treatment. That may involve giving some steroid nasal drops, which tend to shrink the adenoids and open up the natural tube to the ear. There's a little evidence to support this. What is more effective, however, is doing some form of eustachian tube exercises. So for older children, they can do as you do when you're trying to pop your ears on a plane. You squeeze your nose, big breath, close your mouth, and blow up into your ears. So you feel the pressure in your ear. Now, small children can't manage to do this, and therefore we normally recommend using a simple device. This is called an otitis balloon, and it's a small balloon with a little button on the end of it. You put the balloon in the nose, you squeeze the other nostril with a big breath in, and you blow the balloon up. Now, as you blow into the balloon, you get a back pressure up into the ears, which helps clear the fluid from behind the eardrum. Again, very small children don't manage to do this, and sometimes you can play a game with the child where you squeeze the nose and try and get them to blow their parents' fingers off the nose. And they have a few goes and you let them win a few times. And if you can get pressure into the ears, there's good evidence that can help clear the fluid. Now, obviously, this doesn't always work, and sometimes we have to consider surgery. Surgery would involve a short general anaesthetic, i.e. the child will be fast asleep. We'd make a hole in the eardrum and then suck out the fluid and then put a little tube in the ear called a grommet. Hopefully this will show up. This is a tiny little grommet which fits into the eardrum, and it lasts there for about a year to 2 years to ventilate the ear and stop the fluid coming back again. We may also remove their adenoids at the same time as surgery. Glue ear is a very, very common condition affecting many children and often will get better spontaneously. It's important to know this is a temporary and reversible form of hearing loss, which we can get better. If your child has any of these symptoms, we'll be happy to review them in our clinic, and feel free to contact us with the contact details which appear straight after the video. Thank you.